It's now time to turn to our second session this morning, where we'll hear from faculty whose work and research focus primarily on St. Louis. Our first presenter for this session will be Sean Joe, the Benjamin E. Youngdale Professor of Social Development at the Brown School. Professor Joe is here to share his presentation, Homegrown STL, Scaling Impact with Community Partners. Welcome, Professor Joe.
Thank you. So before I begin, it's very important that we set the stage. I love this quote because it allows me to represent the type of work that we're trying to do in the Race and Opportunity Lab. Make no little plans. They have no magic. Make big plans. And aim high in hope and in work. This is what it calls for to tackle the issues that we're trying to discuss at this moment. Imagine with me for a moment that St. Louis is the premier destination for companies, for families, young millennials who want to work in the region. How do we get there? One of the things that's critical to that vision is to ensure that all of us can get there. And one of the key things we understand are young black males in this region, who are among our most vulnerable, must be a part of that vision in order to achieve the outcome of St. Louis being the premier destination of its size for companies, families, and young millennials. What you see before you is a story of St. Louis for the last 40 years. And what the story tells us is this. The social economic indicators of mobility for young black males are headed in the wrong direction. Young black males are less likely to be engaged in work among those 18 to 25 or 29. The median personal income for young black men 18 to 29 in St. Louis used to be about $30,000. For the region, it's about $35,000. It has dropped down now to $11,000 per year. These are young black males who are working. What does that translate into? Roughly about $30 a day. These young men have to take care of themselves and their families, to pay for their health insurance where they can afford it. The vision of St. Louis as a premier destination is directly tied to the life experiences of these young men. What we see here, for example, over time, we see a decline in the income for these young men. St. Louis used to rank 36 in homicide among cities of its size. Now St. Louis ranked, in some measures, number 2 in the top 5, and often, unfortunately, now, number 1. Just suppose these two visions, St. Louis as the best, in terms of positive outcomes, or St. Louis on this train that we've been on and headed in the wrong direction. The killing of Michael Brown really made us think a lot about the experiences of inequality that's taken place throughout the region. Central to that is Michael Brown, a young black man who just turned 18, and whether or not he had the opportunity to really achieve his dreams. The work that we do focus on Homegrown STL, which focuses on how do we increase the upward mobility of young black males ages 12 to 29, of which there's 60,000 in the region. 60,000. As an old New Yorker, please give me that lineage, I'm a little old. As an old New Yorker, that's a couple of blocks. For St. Louis, that's your entire black male populations ages 12 to 29. We have the capacity to do better. Over the last 4 years, we've been doing that, building the infrastructure and momentum to do better. So much so that just the launching of the work that we've done around HomeGrown, which is focused on this capacity building and use of good data, that already the Obama Foundation has been doing work around this issue for a long time, has listed us as one of the 12 communities to watch. We take a community science approach, transdisciplinary science approach. We use every available methodology and information to try to make sure those who need to do strategic planning have the information for which to inform their actions to support this population. So what we want to see here, and we focus on, is a longitudinal study, the largest ever in the investment of black male economic development that any region has put forward, to accelerate the reach of the science of what we know works to support anyone, to transition them from adolescence to young adulthood so they can maximize their full potential. We do this across 7 sectors, focusing on making sure that we have the infrastructure for healing. That means those who are in need can get the need that they deserve and are necessary to move them forward. But you have to build that infrastructure with a community information exchange platform that's bar none. Put social sector and the health sector and all the service sectors, put them in the region with the capacity that it can do better coordination and referrals and strategic collaborations of care. We feel that if you do this, then you can really move into a vision where what we call village building. You must build the system to produce the results that you hope for. Right now, we have the system that's producing the results that we actually plan for. The social ills and inequality that we have is the system built by design. Now, how do we change that? Our vision is that you must have village building activities, you must have focus across the healing support system, you must transform the region with a workforce that's capable of extending and following up with this population. This is no longer you just build it and provide them services and that's it. You have to reach into the homes and support them. You have to do this longitudinally. This is a big vision, but we're working on it and the region is responding. And if we do this with our key partners, with our key agencies, to scale up the impact of all the knowledge that we know that helps individuals to grow and thrive, and we make that available to community, and these partners are coming together with us, then we can make a difference. We think this is a transformative moment for the region. This is a transformative opportunity. This is a transformative moment for Washington University as an anchor institution looking to use its science for the public good. We're talking about system-level change. This is not something that we want to come back 40 years later to see the same sort of data. So what are we trying to achieve? Let's make St. Louis the #1 place in the country for young black boys to grow up. Let's make St. Louis the #1 place in the country for young black men to go to college. Let's make St. Louis the #1 place in the country for young black men to work and to receive a livable wage, a family wage. Let's make St. Louis the #1 place for young black men to be healthy. We have the institutions, we have the philanthropic mindset, we have the capacity to achieve that vision. And all of that operates out of a principle that without excellent science, without excellent research, then we cannot do this. So with that, I say thank you.